The majority of Americans clearly support universal healthcare. And the majority of countries on Earth provide some form of universal access to healthcare for its citizens. But for some reason, universal healthcare is just not possible here. We're told that it's too expensive or just not feasible. We all know that the healthcare industry in the United States is a joke. The insane healthcare premiums and copays, the runaround we get from insurance, the straight up denial of care by the very institutions responsible for ensuring we get care, it's a scam. And the reason for that scam is capitalism. It's the fact that healthcare operates on market principles. It doesn't exist for the purposes of meeting people's needs. It exists for the purposes of making profits by exploiting these needs. And the less care the insurance companies have to pay for, the more profit they make off of us and our illnesses. We live in the wealthiest country on the face of the planet, in the history of the entire world, with access to some of the most advanced technology and research on medicine. As a matter of fact, the United States spends more on healthcare than any other country on earth, just not for you to get healthcare. These arguments that it would be too costly to ensure everyone has access to healthcare are factually just incorrect as well. Even Congress agrees on that point. Their official budget found that a single-payer system that guarantees coverage to everyone would save at least $42 billion a year and as much as $743 billion a year compared to the current system we have in the United States. Plus, we already have some forms of socialized healthcare in the United States. For instance, members of the military and their families get free healthcare from the military health system. Medicare, Medicaid, the Children's Health Insurance Program are all examples of what I'm talking about. There are some problems with these programs, but that's only because they're underfunded. But the money is there. It's just primarily in the bank accounts of the CEOs that run the healthcare industry. But we can go even further than single-payer healthcare and have a fully socialist healthcare system from beginning to end, cradle to grave. A socialist system would end the involvement of any private money-making corporations in any aspect of healthcare. Dramatic savings could come from eliminating redundant administration, like the billing departments and bureaucrats whose only job is to deny coverage and come up with new and creative ways to take our money. Something like $30 billion a year go to advertising to try to get people to buy drugs that are marketed as the savior to their problems. And this kind of marketing is what convinced clinicians that OxyContin wouldn't lead to addiction, and is why tens of thousands of people die from opiate drug overdoses every year. Without this whole aspect of the healthcare industry, think about how much money there'd be. And the average CEO of a healthcare company makes $11 million a year. Think about how much money could be saved by getting rid of those positions. No CEO or other top executive actually provides care to sick people anyway. They just dream up new ways to make more money, and specifically make money off of our sicknesses. We deserve so much more than the system has to offer us. And it's time we recognize that, internalize it, stand up, and fight for the socialist alternative that can give it to us.